Hello everybody, and welcome to Arthritis 101. Today, I will be giving you a brief overview of arthritis. Who gets it? What is it? Where does it occur? Why do people get it? And how does it affect your body? So let's get started. The word arthritis means joint inflammation. The first part of the word arth means joint, and the last part of the word itis means inflammation. However, as we will learn, not all types of arthritis is a result of inflammation. So what is a joint? A joint is a structure that connects bones and permits body parts to move. Examples include wrists, elbows, shoulders, and knees. Let's refer to the diagram. Here you see two bones meeting. At the end of each bone is covered with cartilage. The cartilage acts as a shock absorber, allowing bone ends to glide smoothly across each other. Surrounding each joint is a joint capsule, held together by muscles and tendons. Inside this capsule resides joint fluid that acts as a lubricant between the joints. When someone has a condition like rheumatoid arthritis, which results in inflammation of joints, the part that is affected is called the synovial membrane, represented by the yellow line. The synovial membrane lines the inside of the joint capsule, and when it is inflamed, it produces a lot of synovial fluid, which in turn causes a joint to swell. The swelling causes increased pressure in the joint, and that can be very painful. Inflammation is our body's natural response to injury, including infection and trauma. We can tell that something is inflamed if it looks swollen, red, hot, and the patient reports pain. Inflammation can also be detected in the blood. ESR, or erythrocyte sedimentation rate, and CRP, or C-reactive protein, are two common blood tests that we use to measure inflammation. There are many types of arthritis that involve inflammation of the joints. We use this umbrella term inflammatory arthritis to describe different types of arthritis, including rheumatoid arthritis, psoriatic arthritis, gout, and ankylosing spondylitis. Many types of inflammatory arthritis are also autoimmune, systemic, and chronic diseases. An autoimmune disease occurs when your body's immune system attacks its own healthy joints, causing inflammation in the joint lining. A systemic disease refers to inflammation that affects other areas of the body, including eyes, hearts, lungs, and skin. A chronic disease is when there is no cure, but with proper treatment, many patients can enjoy active lives and prevent long-term damage to their joints. This slide emphasizes that inflammatory arthritis can affect not only the joints, but also other parts of the body. That is why many patients report a variety of symptoms depending on which parts of the body are affected. And sometimes symptoms can be very nonspecific, like fatigue, fever, weight loss, shortness of breath, rashes, abdominal pain, and eye pain. In fact, one of the most common symptoms is fatigue. Patients often report an ongoing feeling of extreme tiredness that is not relieved by rest. This is likely multifactorial, including poor sleep due to pain, anxiety, lack of activity, and deconditioning. It is also believed that fatigue is due to the body's immune system being on constant overdrive, attacking itself and damaging the body. For some patients, this process may have been going on for months to years prior to being diagnosed and treated. Another type of arthritis that usually does not involve inflammation or the immune system is called osteoarthritis. This type of arthritis is very common and is due to the breakdown and loss of cartilage causing the bones to rub together. This is painful because it irritates the nerve endings found at the end of the bones. This can cause some mild swelling, pain, and stiffness. However, unlike inflammatory arthritis, these symptoms are localized to the joints, so patients do not report systemic symptoms. Often we get asked, how can we tell whether patients have osteoarthritis or inflammatory arthritis? One of the ways you can tell is by looking at which joints are affected. Someone who has osteoarthritis, we often think of weight-bearing joints, and it is often asymmetrical, like the right knee or left hip. For rheumatoid arthritis, it's often affecting both sides of the body, and common joints include knuckles, wrists, elbows, ankles, and toes. Certainly, a patient can have both osteoarthritis and rheumatoid arthritis, so the pattern of joint involvement is not always helpful. So why is it important to distinguish between osteoarthritis and rheumatoid arthritis? Well, the disease process is very different, and therefore we treat these diseases very differently. Here's a diagram of a normal joint on the left, osteoarthritis in the middle, and rheumatoid arthritis on the far right. In osteoarthritis, the problem is in the joint space. The joint space is lost and the cartilage has been worn down. In rheumatoid arthritis, the problem is in inflammation. This leads to more profound swelling and damage to multiple parts of the joint, including the joint capsule, tendons, ligaments, and the bones themselves. We can also see changes on X-ray due to rheumatoid arthritis. Here's an X-ray of a patient's right hand on the left with rheumatoid arthritis and a normal hand on the right. In the X-ray of rheumatoid arthritis, you can see that the fingers are deviated to the right. Some of the bones and joints are also destroyed or displaced. The wrist is also completely fused. These changes are irreversible. The exact cause of inflammatory arthritis is unknown. A variety of factors have been postulated, including genetics, family history, gender, environmental factors, smoking, and age. For example, research shows that women are 2 to 3 times more likely than men to get rheumatoid arthritis, while ankylosing spondylitis is much more common in men. So how do we diagnose inflammatory arthritis? The diagnosis is based on several things. The history, so what the patient tells us in terms of symptoms, physical exam, blood work, imaging including X-rays and MRI, as well as joint fluid analysis. Often, we use more than one component to help make a diagnosis. In terms of symptoms, we are interested in knowing how a patient's arthritis is affecting their daily functioning, pain, morning stiffness, and fatigue. These symptoms can be captured in a questionnaire that they fill out prior to every visit called a HAQ, or Health Assessment Questionnaire. This HAQ form helps guide treatment decisions, so it is very important that patients complete this. To help monitor your arthritis, your physician may also record the number of tender joints, swollen joints, other measurements, and calculate a disease activity score. There may be periods of time when your arthritis gets worse, and this is called a flare. A flare is when there are more tender and swollen joints. You may experience a decrease in joint mobility, increase in duration of morning stiffness, a decrease in muscle strength and functioning, and other nonspecific symptoms like fatigue, low-grade fever, decreased appetite, and weight loss. Again, it is normal for your arthritis symptoms to wax and wane over time. So what do you do when you experience a flare? There are many strategies. You can consider resting the affected joint, using a painkiller and/or anti-inflammatory recommended by your physician, modifying your exercise program, using heat or cold pre and post exercise, and importantly, if your flare does not improve and you've tried these strategies, or it is occurring more frequently, you should contact your rheumatologist. It is very important that inflammatory arthritis is treated as early and aggressively as possible to put out the fire in the patient's joints. This prevents joint damage, preserves or prevents loss of function, decreases pain and swelling, and prevents and/or treats systemic issues related to inflammatory arthritis, such as heart disease. We treat inflammatory arthritis using medications and non-pharmacological strategies. In the next few sections, we will discuss these in further detail. Thank you for your attention.